Currently, our women and families are seen in a small antenatal clinic.
And it very much felt that we had outgrown that space.
This is what our women say, this is what our staff say, this is what we'd like to design towards.
As part of our Outstanding Maternity Services programme, the Women's and Newborn Unit at Bradford Royal Infirmary is undergoing an ambitious £15.5 million worth of refurbishment. In August, we proudly opened our brand new Antenatal Clinic, which is already making a difference for patients and staff alike. With a brighter reception and waiting area, improved assessment spaces and enhanced facilities, the clinic has been designed to provide greater comfort, privacy and efficient care for pregnant women from across the district. Today, we'll hear from Sarah Elton, Consultant Obstetrician and Gynaecologist, and Alison Powell, Midwifery Lead for the Outstanding Maternity Services programme, who will share how these improvements will support patients and staff and ensure our facilities are fit for the future.
The space in which you deliver care is an important part of making people either work efficiently and effectively or for families to feel safe and secure.
This is our current antenatal clinic. This waiting area is really, really small, so it's almost outgrown the number of women that we've got coming through.
You've seen downstairs where everyone's all in a melee together and there's a cafe in the midst of it, and it's not a particularly pleasant place to be.
And at the beginning of this project, the clinic space was used by various patient groups.
And it very much felt that we had outgrown that space and outgrown those facilities, and those facilities definitely needed a bit of an upgrade when we were downstairs.
The floor really needed improving purely from the fact that we've outgrown the space. These are our current antenatal clinic rooms. As you can see, they're fairly small and they're not really fit for purpose in terms of size.
The whole idea was a better patient experience.
So when we started, we knew there were lots of changes that needed to be made.
I was invited to be part of the building work stream along with one of my consultant colleagues.
And so right from the beginning, we've engaged with our service users, our stakeholders and our workforce and asked the question, what would an outstanding service look like?
So it's been really interesting and nice to work with a different group of people, and it gives you a little bit of a better idea what happens in the wider field around the hospital.
So one of the things that we've tried to achieve in the new antenatal clinic is a kind of calm and less chaotic environment. As you can see, the antenatal clinic behind is quite busy.
So knowing that we needed a building to change, we then did work around what needs to change where, what are we missing and what do we need to design to. This is what our women say, this is what our staff say, this is what we'd like to design towards. That also improves their privacy, their dignity and protects their confidentiality. So we listened to our service users and we did what they asked us to do.
So creating a space that's focused around the pregnant woman and her needs was really important to us.
The new way of working in antenatal clinic will be the clinicians will be on the outside corridors doing that kind of backstage work, and then patients will flow through the middle and into the rooms.
Hence why we've sort of set the clinic up with a specific doctor and midwife area and more a patient area as well, to separate the two and make it a calmer environment.
It's been tough, but it's been worth it, and I didn't expect to be doing this when I started out as a midwife, but it's all for our service users and that's what matters. So I'm really excited to welcome our women and families to our first clinic later on.
We have over 50 patients coming to see us.
I know when they open the door and they come, they're going to feel relaxed and it'll be a much better experience for them.
The environment mustn't underestimate how important it is about keeping women calm and relaxed during the pregnancy. We know that makes women feel like more in control. It makes women feel kind of calmer, more settled when they come into something that could potentially be stressful.
You'll see the staff facilities up here are much nicer than they are downstairs. Now our surroundings match the excellent working team we've got.
In this journey over the last 4 years, we've created a new gynaecology clinic, which is on level 3, and we've created a new maternity assessment centre, and so we've separated patient groups. This is the final stage of that.
What I'm really keen of is that the women who come to our antenatal services in Bradford have the best experience that they can get.